We've come together today to talk with you all and jointly and respectfully announce the factors influencing why we are not participating in the current process to establish the currently proposed independent children's hospital in Richmond. This will be based on the current set of circumstances in the healthcare environment. And as Tony and I said earlier, we are not here to say never forever. We are here to say that at this point, these are some of the issues with which we are dealing, and they are very serious and difficult issues. I think more importantly, we're also here to say that we have come together to agree to refocus our efforts to advance children's health through greater collaboration and through specific initiatives that will help to improve access and the coordination of care for all children in Richmond and beyond. This is unequivocally a joint decision. We've come together to talk with you in a joint fashion. We have come together after being together for quite some time in thorough and deep discussions and after careful review. I will also say that it is unequivocally a very difficult decision. More than a year ago, we at VCU announced that we would engage in a sincere, heartfelt intent to be part of an independent children's hospital that, we said it many times, would clearly enhance pediatric research, education, and clinical care for all children in Richmond. We believe that it was a worthwhile effort. We've invested thousands of intense hours and substantial resources to try to make this work for all of us, including our 177-year-old medical school. We've determined that the currently proposed freestanding independent children's hospital is just not currently a viable approach for either VCU or Bon Secours, and is not a sustainable model at this time under the current megatrends that we face. There are a number of contributing factors. Most importantly is the ongoing instability of the healthcare industry and very significant changes in best practice care models. Cuts to hospitals under federal and other programs, coupled with increased focus on cost savings by our commercial insurance payers, have absolutely placed us with additional pressure in both of our systems as we continue to care for the underserved and all of those who are in need in our communities. Also, the currently proposed independent model looks to be opposite of the general direction in which healthcare is tending to focus, largely because of costs. National and local healthcare industry trends are moving away from more of the standalone facilities, making it challenging for those standalone facilities. What's happening is there is a move more toward coordination, consolidation, care networks that leverage existing facilities and promote more outpatient, technology-based, and home-based programs. With advances in care and technology and the bulk of patients and more of patients increasingly are being treated in an outpatient setting. Our participation in an independent children's hospital was focused specifically on enhancing our missions. The proposed ICH that is currently under discussion could not assure us that our missions would be enhanced. At this point, what we saw was that we couldn't manage the kind of risks that we saw with the costs that would be inevitable to the current proposal. We're at the beginning of a collaborative relationship with VCU and Bon Secours that we have become very proud of already. Richmond is very fortunate to have two great health systems that have come together for this discussion. We obviously have other health systems like HCA that also provide great strength in this community as well. But I want to say that I'm very pleased that this discussion has elevated Bon Secours and VCU to a point where we've been able to put our heads together and successfully decide what are some of the things that we really need to be doing in order to provide better care in a more coordinated fashion and address some of the fragments that exist in terms of care for children and their parents in this community. We want to take a moment to sincerely thank Bill and Alice Goodwin and the pediatric healthcare community for shining a really important spotlight on children's health. We don't think we'd be here at all talking about what we're talking about if it weren't for their leadership, their incredible vision, and ultimately a significant difference that we know will be lasting in our community. Tony and I had an opportunity to speak with Alice and Bill Goodwin yesterday about the challenges that we face before we came to a decision. They are understandably, like so many other people, disappointed at this point in time, but they were very gracious about accepting our decision at that point. We discussed the highly unstable and highly unpredictable healthcare environment. I know of no one who is a better problem solver than Bill Goodwin. And of course, he, like us, understands that right now there aren't answers to a lot of very difficult questions that must be asked. We explained that this is not a process that has been in vain, that we have heard loudly and clearly that it really is time for us to collaborate and to eliminate the barriers to navigation and the fragmentation of services. We're going to continue to commit significant resources to build our existing clinical, teaching, and research foundations that we have built at the institution and to explore more opportunities to create integrated networks based on our collective strengths. And let me tell you, there are significant collective strengths in our community. If this arduous process so far has showed us anything, it's that our health systems can indeed come together in so many ways that will have a positive impact on children and their families in the communities in the Richmond metropolitan area. I have to say I've truly enjoyed getting to know and working closely with Tony, and I would also say Rich Statuto, who is the head of the whole Bon Secours system. These are solid healthcare executives who understand, just like our healthcare executives at VCU, better than anybody could understand, the incredibly complex, difficult, unpredictable, unstable environment that we face in healthcare. VCU is absolutely committed to collaboration, and I have full faith that Bon Secours is committed to collaboration as well. At this point, I want to invite Tony Artebel, CEO of Bon Secours Richmond Health System, to share some of her thoughts.
Thank you, Mike. I want to first say how committed Bon Secours is to work with Mike and the VCU team. We do appreciate the fact that the process that we have followed around the Children's Hospital has brought us together in a collaborative way to work for the health of children in the community. You know, it goes without saying that Bill and Alice are among the finest philanthropic partners that this community has, and perhaps in the United States. It's clear that their mission in this endeavor was about making life better for children and families in this community. And that's also the mission of Bon Secours and VCU. We may see perhaps different ways to do that in the future, because this particular project at this time, as Mike has said, in such a unstable healthcare environment, it was very difficult to go forward with the project. However, we do all have the intention of what was meant to occur with the project, and that is better care for children in our community. Equity in ownership and governance for Bon Secours was one of the issues that was a stumbling block for us. And of course, for VCU, it's about academic management and governance as well. And those were areas in the current environment that had to be solved, and we did not have good solutions for them. It is important to note that our current healthcare systems have dramatically over the last 5 years grown in capabilities, in depth and breadth of our pediatric subspecialties, and in the types of programs that we have offered to the community. I think everyone involved in this exploration expended tremendous amount of time and resources to look at the feasibility. We all went into the process wanting to make a children's hospital happen in Richmond. We care about the needs and desires of our patients and families and caregivers and our community pediatricians, and we're committed to assuring all of those stakeholders that care will continue to improve in Richmond. We do understand the importance of access and coordination of care. John Duvall and I have had several conversations about what we could do immediately, especially around the care coordination initiative with nurse navigators and also with iPad apps, which is a way that a lot of young folks like to get their information. We are grateful for the Goodwin family for bringing this to our community, for being a catalyst for discussion, and for insisting that Bon Secours and VCU work together in this initiative. And it has indeed brought us together. So now it is time to look for some new directions. And for us, moving forward means the collaboration that Mike talked about. We strongly believe that is the key to advancing healthcare in Richmond. Our investment has resulted in mutual respect between us and has forged a working relationship that is good for the entire community. We will work together, we will continue collaborating where we can be most valuable in addressing the most important children's healthcare issues, which include sharing technology, sharing attention to health risk that could include obesity, asthma, which is a common admission reason for pediatric patients in our community, and violence against and involving children, something that VCU has been a leader in, and now we will collaborate across our health systems. And we hope to invite participation from other organizations in our community, other healthcare organizations. Perhaps some of the insurance companies might like to be involved. So we're very open to participating in a much broader way. I'd like to conclude with really two important messages. First, we pledge, Bon Secours and VCU, to the parents and children of Greater Richmond and Central Virginia that we will always strive for excellence and to grow pediatric specialty care in collaborative ways that will benefit all children and their families. Secondly, we pledge to the community of pediatric healthcare providers continued cooperation between VCU and Bon Secours and the sharing of benchmark, research, and care models, and to continue efforts to look for synergistic ways to improve the health care of our community and our children as a whole. Thank you.